Hello friends, good evening. Welcome to NEET PG Live Daily. Myself Dr. Apurva Mittal, and today we'll be discussing about inhalational anesthetics, which are used most commonly in anesthesia. And today I'll be just talking about the basics which are regarding the inhalational anesthetics. Okay, on this prestigious platform of Unacademy, which is one of the India's leading platform for online courses, and by getting the Unacademy subscription, you'll be able to avail all the live classes and interact with the educators for all the 19 subjects, and we'll be having a daily test series and analysis in which you can progress, you can evaluate your progress, and you can know the type of questions which are asked in the various exams. And we'll be having live doubt clearing sessions in which you can clear the doubts pertaining to that subject. Okay, so this are the advantages of getting the Unacademy Plus subscription. This Unacademy Plus subscription, it's either a 12 months or a 24 months course. And if you apply my code, that is Apurva Live, APOORVA Live, you can get 10% discount for the same. Okay, so friends, let's start our today's topic of inhalational anesthesia. I hope I am audible and clear. Okay, so today I just told you that in inhalational anesthetics, what we'll discuss is the what are the principles behind it, how does it actually work. So we'll discuss only about the basics today. And so first we'll see what is oil gas partition coefficient, what is minimum alveolar concentration, what do we mean by blood gas partition coefficient, then what is concentration effect, second gas effect, diffusion hypoxia, and today we'll just discuss about ether. Okay, and tomorrow we'll discuss about all the other inhalational agents like halothane, iso, desflurane, sevoflurane, and nitrous oxide. Okay, so today I'm just telling you the basics about the inhalational anesthetics which is there. So friends, first coming to the first objective of the class, that is first of all, what are inhalational anesthetics? Okay, what are inhalational anesthetics? As the name suggests, we are inhaling something. Okay, we are inhaling something, and that drug possesses the anesthetic qualities. Okay, so what are inhalational anesthetics? They possess the anesthetic qualities. Okay, and how they are administered. See, friends, I told you, from the anesthesia machine at the correct pressure, the oxygen and nitrous or air will come out, and when it passes through the vaporizer, okay, when this passes through the vaporizer, which is a part of the low pressure system, there will be addition of the volatile anesthetic, and this mixture of oxygen, nitrous or air and the volatile anesthetic will come out of the common fresh outlet, enter into the breathing circuit. Okay, so the mixture of oxygen, air and or nitrous, okay, along with it the volatile agent, it will come from the common gas outlet, enter into the breathing circuit, and through the airway device, either through the anesthetic mask or the supraglottic or the ET tube which is connected to the anesthesia machine, will be delivered to the patient. Okay, so this is how the inhalational anesthetics are administered. Okay, so these are the drugs which have the anesthetic qualities. Now, coming to the first basic principle, that is the oil gas partition coefficient. Okay, see, you have to understand the basics. ऑयल गैस क्या होता है, ब्लड गैस पार्टीशन क्या होता है, डिफ्यूजन हाइपोक्सिया, कंसंट्रेशन इफेक्ट, तो ही तुम लोगों को ना इनहेलेशनल एनेस्थेटिक्स कैसे काम करते हैं, कौन से फैक्टर्स उसको अफेक्ट करते हैं, तभी समझ में आएगा. ठीक है, एंड मेनी क्वेश्चंस हैव बीन आस्क्ड इन नीट पीजी फ्रॉम दीज कंसेप्ट्स. ठीक है, तो इसलिए ये वाली क्लास बहुत इंपॉर्टेंट है, तो अच्छे से समझने की कोशिश करना. If any doubt in between, let me know. I'll revise that topic once more. Okay, so that is why just please listen to me carefully. तो ऑयल गैस पार्टीशन कोएफिशिएंट, नाम से ही पता चल रहा है, दैट इज द कंसंट्रेशन ऑफ दिस इनहेल्ड एनेस्थेटिक इन द ऑयल. ऑयल का मतलब इधर ये है, दैट इज द कंसंट्रेशन ऑफ एनेस्थेटिक एजेंट इन द लिपिड. ठीक है, इट इज लाइपोफिलिक, तो कितना वो टिश्यूज में डिसॉल्व हो पा रहा है अपॉन द कंसंट्रेशन of inhalational agent which is present as the gas. See, ये alveoli है, ये जो ग्रीन कलर का है ये alveoli है. ठीक है, तो पेशेंट ने इनहेल किया, ये जो गैस है ये पूरी अपनी ऑक्सीजन, नाइट्रस और वॉलेटाइल एनेस्थेटिक है, तो इसके अंदर वॉलेटाइल एनेस्थेटिक भी है. ठीक है, नाउ दिस विल गेट एब्जॉर्ब बाय द alveolar capillary membrane. ठीक है, and this will get absorbed by the alveolar capillary membrane. और थोड़ी amount of gas will not dissolve in the blood. Some amount of gas will not dissolve in the blood and will remain in the gaseous form. ये जो सिर्फ black है, it is only in the gaseous form. और ये जो red के अंदर mix हो गई है, it is dissolved in the blood. Okay, and from here it will be absorbed by the lipid membrane, जैसे it will be absorbed by the brain. Okay, so it is the what it is telling us, it is telling me about the ratio of concentration of the drug in the lipid. It is telling me the ratio of concentration of drug in the brain. Okay, in the brain by the concentration of the anesthetic agent which is still in the gaseous form. ठीक है, तो oil gas partition coefficient, that is the concentration of the drug in the brain, that is the lipid bilayer से जो absorb हुआ है upon the concentration of the gas inhalational agent which is present in the gaseous form, which is not dissolved in the blood. ठीक है, तो जो भी highly lipid soluble drug होगा, highly lipid soluble drug क्या होगा, it will diffuse easily across this lipid bilayer. ठीक है, तो उसका concentration ब्रेन के अंदर easily produce हो जाएगा. So very less amount of inhalational anesthetic is required to produce anesthesia. समझ में आया? जितना वो ड्रग लिपिड सॉल्युबल होगा उतना इजीली वो ब्लड ब्रेन बैरियर क्रॉस करके ब्रेन के अंदर जाएगा. ठीक है, उतना ही इजीली वो ब्रेन के अंदर जाएगा और उतना ही कम अमाउंट ऑफ इनहेलेशन एनेस्थेटिक इज रिक्वायर्ड टू प्रोड्यूस द एनेस्थीसिया. अगर लिपिड सॉल्युबिलिटी कम है तो हमें कंसंट्रेशन ऑफ द ड्रग बढ़ाना पड़ेगा फॉर दैट ड्रग टू कॉज एनेस्थीसिया. ठीक है, सो what is potency? Potency is the amount of drug needed to provide a given effect. Okay, so more the lipid soluble. Okay, so oil gas partition coefficient क्या बता रहा है? It is the measure of the potency of the drug. How potent the drug is known by the oil gas partition coefficient. More lipid soluble, more easily it will cross the lipid bilayer and less concentration of the inhalational drug is required to produce anesthesia. Like the methoxyflurane है. ठीक है, ये याद रखना, methoxyflurane has maximum oil gas partition coefficient. ठीक है, इसका मैक्सिमम ऑयल गैस पार्टीशन कोएफिशिएंट है. इसका मतलब क्या हुआ? इट इज हाईली लिपिड सॉल्युबल. इसका मैक्सिमम ऑयल गैस पार्टीशन कोएफिशिएंट है. ठीक है, दैट मीन्स द कंसंट्रेशन ऑफ द ड्रग इन which has crossed the lipid bilayer upon the concentration of drug which is present in the gaseous form. तो उसका जो रेशियो है, अगर न्यूमरेटर बड़ा होगा तो दैट मीन्स ऑयल गैस पार्टीशन कोएफिशिएंट ज्यादा होगा. ठीक है, इसका मतलब इट इज इजीली क्रॉसिंग द लिपिड बाइलेयर एंड एंटरिंग इनटू द ब्रेन and therefore it is most potent. ठीक है, is it clear? Is it clear? ऑयल गैस पार्टीशन कोएफिशिएंट क्या है? एंड वो क्या बता रहा है, इट इज टेलिंग मी अबाउट द पोटेंसी ऑफ द ड्रग, हाउ इजीली द ड्रग कैन पास टू द लिपिड बाइलेयर. ठीक है. अब ये जो नाइट्रस ऑक्साइड है, it has minimum oil gas partition coefficient, it is least soluble and it is least potent drug. ठीक है. So it is least soluble and it is least potent drug. Is it clear? Oil gas partition coefficient, is it clear? ठीक है. एक और बार बता रही हूँ, inhalational anesthetic alveolar में आया, उसमें से some amount of it will be present in the gaseous form, some amount of it will be absorbed in the blood and then into the through the lipid bilayer membrane. Okay, so amount of drug which is present, the concentration of the drug in the lipid by the concentration of the drug in the gaseous form, that is the oil gas partition coefficient. ओके, तो जितना ज्यादा, दैट इज इट इज मोर लिपिड सॉल्युबल, उतना ज्यादा वो पोटेंट. और उसका एग्जाम्पल क्या है, मेथॉक्सीफ्लोरिन का सबसे ज्यादा ऑयल गैस पार्टीशन कोएफिशिएंट है और नाइट्रस का सबसे कम ऑयल गैस पार्टीशन कोएफिशिएंट है. दैट इज नाइट्रस ऑक्साइड इज लीस्ट सॉल्युबल इन द ब्लड. ये पॉइंट याद रखना. यू come to know why I am focusing on this point in the diffusion hypoxia or the concentration effect. Nitrous oxide, it is least soluble in blood. ठीक है. So that is what is there. Now, what is the minimum alveolar concentration? Minimum alveolar concentration is dependent upon the oil gas partition coefficient. कैसे? मिनिमम एल्वियोलर कंसंट्रेशन, इस नाम को ही देखो, इसका मतलब क्या हो रहा है, दैट इज हाउ मच लेस अमाउंट ऑफ ड्रग. ओके, हाउ मच लेस अमाउंट ऑफ ड्रग कैन प्रोड्यूस एनेस्थीसिया, मतलब कितना ड्रग alveolar में gaseous alveolar में, see, from the alveoli the drug is going into the blood vessel and from here it is going into the lipid rich membrane, lipid rich environment. For example, ये brain है. ठीक है. तो ये alveoli से blood vessel से brain तक तब तक जाता रहेगा जब तक एक इक्विलिब्रियम मेंटेन नहीं हो जाता. ठीक है. जब तक एक इक्विलिब्रियम मेंटेन नहीं हो जाता तब तक ये जाता रहेगा. ठीक है. तो मिनिमम एल्वेलर कंसंट्रेशन इज दैट इट इज द लोएस्ट कंसंट्रेशन ऑफ एनेस्थेटिक गैस इन द एल्वेoli. एल्वेoli में सबसे कम कंसंट्रेशन ऑफ एनेस्थेटिक गैस दैट कैन नॉक आउट द पेशेंट. Okay, that can knock out the patient. Basically, how much less amount of drug in the alveoli, okay, can show its effect on the brain. Okay, how much less amount of drug can produce knockout effect, can cause anesthesia, can cause loss of consciousness. Okay, a minimum alveolar concentration is, इसकी डेफिनेशन इम्पॉर्टेंट है, इट इज द लोएस्ट कंसंट्रेशन ऑफ द एनेस्थेटिक गैस इन alveoli needed to produce immobility in response to, याद रखना, painful stimulus, and that painful stimulus is nothing but the surgical incision in 50% of the individuals. ठीक है. Every individual is different. It is defined as itna amount, itna minimum amount of drug in the alveoli that will produce the immobility to what? To a painful stimulus. कितना painful? Like the surgical incision वाला जो pain होता है. In 50, at least 50% of the patients have been knocked out with that particular amount of the drug. That is the minimum alveolar concentration. Is it clear? What is minimum alveolar concentration? If any doubt, let me know. If any doubt, let me know. So, अब potency क्या था? Potency was the oil gas partition coefficient. ठीक है, जितना ज़्यादा lipid soluble उतना ज़्यादा potency of the drug. Okay, so MAC is inversely proportional to the potency of drug. Okay, higher the MAC, higher the amount of drug which is needed to produce the unconsciousness, lesser is the potency of that drug. Lower the MAC value, higher is the potency of the drug. So basically, MAC is inversely proportional to the potency of drug. Okay, so this is the minimum alveolar concentration. This is very important funda which has been asked in NEET. इसका क्वेश्चन पूछ सकते हैं, व्हाट इज मिनिमम alveolar concentration, individual anesthetic agents which are used, you should know the MAC value of those. What are the factors which produce this MAC? So MAC is basically inversely related to the potency of the drug, and potency of the drug was determined by the oil gas partition coefficient. ठीक है, समझ में आया? Okay, so for example, methoxyfluorine. मिथॉक्सीफ्लोरिन का ऑयल गैस पार्टीशन कोएफिशिएंट क्या था? इट वाज मैक्सिमम. तो इसका जो मैक है दैट इज 0.16, दैट इज इट इज द मोस्ट पोटेंट. ओके, इसका इतना कम अमाउंट इज नीडेड टू ब्रिंग the knockout 50% of the patient, whereas nitrous oxide was least potent. That means uska higher concentration is needed in the alveoli to bring the same amount, okay, to bring the same result, and that is why it is least potent. So nitrous oxide ka blood gas partition coefficient is less, it is least, but MAC is maximum as it is inversely proportional. Is it clear? Is it clear? Okay. So there are different types of MAC, that is minimum alveolar concentration. देखो incision के वक्त जब सर्जरी का incision लगाते हैं वो तो MAC 50 है, ठीक है, that is minimum alveolar concentration to knock off 50% of the individuals. Okay, to knock off 50% of the individuals. But sometimes some other individuals are not that much affected by this much concentration. So what is MAC 95? MAC 95 is nothing but the minimum alveolar concentration which will immobilize the patient to surgical, which will immobilize 95% of the patient to the surgical stimulus. So that is MAC 95. Okay, and that is 1.3 times the MAC 50. ठीक है, so MAC 95 9 से क्या याद रखोगे? 3. ठीक है, तो it is 1.3 times the MAC 50. Okay, MAC bar क्या होता है? MAC bar याद रखना, it is the MAC which is required to suppress the adrenergic response to the painful stimulus. Okay, it is required to suppress the adrenergic response to the painful stimulus, and that is MAC bar. Okay, that is MAC bar, and that is 1.5 times of MAC 50. Okay, so MAC incision, MAC 50, MAC 95 is 1.3 times MAC bar. इसको ऐसे भी याद रख सकते हो, बार में गया है पेशेंट, okay, he had some amount of alcohol and he is hyperactive, so I need more stimulus to bring him down. तो इसलिए it is maximum 1.5 times MAC 50. ऐसे भी एक तरीके से याद रखा जा सकता है. Okay, now MAC intubation. Intubation में क्या है? To suppress the hemodynamic response, the laryngeal response, it produces the sympathetic overactivity. Okay, it causes the release of the catecholamines. Okay, and it is more painful than the surgical incision. So इसलिए higher dose is needed for the inhalation anesthetic during that time. So MAC intubation I is 1.1. कैसे याद रखोगे? 1.1. 95 के 9 से 1.3. 9 3 3s are 9. I intubation 1.1. Okay, so that is to suppress the hemodynamic response to the surgical intubation. And MAC awake, a patient को हमें conscious करना है, तो उसका MAC सबसे कम होगा, है ना. So that is only 0.3 times the MAC 50. Okay, so this you have to remember. What are those and what is it? What is the value? So this is about the minimum alveolar concentration, the funda of it. Now, minimum alveolar concentration of different common inhalational agents, what it is. So always remember, okay, everything in inhalational anesthetic is in this order. Okay, it is in this order. Okay, his dream. Okay, so halothane, iso, CO, des. Okay, and nitrous अलग से. So halothane, iso, CO and des. See, halothane का जो है, halothane, ठीक है, halothane का जो है, that is around 0.75. The MAC of halothane is 0.75. Good evening, Dr. Raina. Ma'am, type 3, I didn't get you. Could you please tell me what is ma'am type 3? I didn't get the question. Okay. So, okay. So I'm just telling you about the MAC of different common inhalational agents. That is the nitrous oxide. The nitrous oxide का हम लोगों को अलग से याद रखना है. That is 105. And I was telling you about halothane. Halothane is 0.75. Isoflurane का इसका almost double है. Okay, that is 1.2. आइसो से आई आ गया तो यहाँ पे 1 आ गया. 1 के बाद क्या आता है? इट इज द सेकेंड ऑर्डर में आ रहा है आफ्टर हैलोथेन आइसो, तो 1.2. ओके, sevoflurane is 2. ओके, सो सेवो, इसको ऐसे याद रखना. इसका एस को अगर तुम उल्टे जैसे दिखोगे तो ये कैसा रिजेंबल कर रहा है? 2 जैसा. तो sevoflurane का जो होता है दैट इज 2. desflurane it is 6. okay, desflurane is 6. okay, so halothane is okay. I'll just tell you, Dr. Raina, I'll just tell you what is MAC intubation. Just let me complete with this. Halothane is 0.75. Isoflurane is 1.2, SCO is 2, DES is 6, and nitrous is 105. Okay, so these are the MAC of different values. See, Dr. Raina has asked me that she didn't understand the concept of MAC intubation. I'm just telling that MAC intubation is during intubation. See, at the time of the surgical stimulus, you need MAC 50. मतलब अगर 0.16 of the concentration of the methoxyflurane. ठीक है, अगर हम लोगों को चाहिए कि पेशेंट को कुछ भी रिस्पॉन्स ना हो, sympathetic response, because of the laryngeal stimulus which is happening during the laryngoscopy, I have to keep the concentration of the inhalational anesthetic to be 1.1 times of MAC 50. Okay, is it clear? MAC intubation में हम लोगों को MAC 50 से 1.1 times ज़्यादा रखना है, so that the patient does not feel or the patient का hemodynamic response to laryngoscopy is not there. Is it clear? Is it clear? For example, I'm just telling you the example. Okay, MAC 50. Okay, MAC 50 for desflurane is 6. So this I need when I'm giving the surgical stimulus like skin incision. Okay, but जो लैरिंगोस्कोपी है, लैरिंगोस्कोपी इट्स अ वेरी पेनफुल रिस्पॉन्स, ओके, और इसमें सिंपैथेटिक स्टिमुलेशन होगा फॉर द पेशेंट, कि इसमें ये सिंपैथेटिक एक्टिविटी ना आए, उसके लिए मुझे जो कंसंट्रेशन, जो मैक चाहिए वॉलेटाइल एनेस्थेटिक के जो चाहिए, दैट शुड बी 1.1 टाइम्स ऑफ 6, okay, so that the patient's hemodynamic stability is maintained. Is it clear, Dr. Raina? Is it clear, Dr. Raina? Okay, so that I told you about the map of common inhalational agents. Now, what are the factors? Okay, please give me a thumbs up if it is clear, Dr. Raina, so that I can move forward. Okay, so now what are the factors which are affecting the, okay, fine. Now, there are certain factors which affect the minimum alveolar concentration. ठीक है, तो कोई कोई सी चीजें minimum alveolar concentration मतलब the amount of anesthetic agent to knock out the patient increase हो सकता है because of some factors, decrease हो सकता है या फिर same रह सकता है, ठीक है। तो इंक्रीज किस किस चीजों में होता है, याद रखना 4 हाइपर चीजें प्लस द एज ग्रुप ऑफ ड्रग, ओके, एंजियोटेंसिन कन्वर्टिंग एंजाइम ग्रुप ऑफ ड्रग्स, इन जगह पे आई नीड टू इंक्रीज द मिनिमम alveolar concentration to knock off the patient. So these are hyperthermia. 4 हाइपर चीजें क्या है, hyperthermia, ठीक है, if the patient is having hypernatremia, okay, in hyperbaric states, and also याद रखना chronic alcohol intoxication. In chronic alcohol intoxication, the patient needs more amount of MAC, okay, उसको inhalation agent ज़्यादा चाहिए, more amount of MAC to knock off the patient, okay. So for hyper plus this is hyperthermia, hypernatremia, hyperbaric, and chronic alcohol intoxication. Whereas in acute alcohol intoxication, the MAC value, it decreases, okay. In acute alcohol intoxication, the MAC value decreases. Rest जितने भी conditions exam में पूछे जाएंगे, they all decrease it, be it hyponatremia, okay, hypothermia. So all those things, hypomagnesemia, hypocalcemia, they all decrease the MAC. Okay, so the only 4 things that increase the MAC इसको याद रखना, hypernatremia, hyperthermia, hyperbaric states, and chronic alcohol intoxication. What factors does not affect the MAC value? That is the gender of the patient, be it male or female, and also the thyroid disease. Both in hyper and hypothyroidism, the MAC value of volatile anesthetics remains same. We neither increase or decrease the MAC value, okay, to knock off the patient. Is it okay? Is it okay? Now, ये याद रखना, in the young age increases the MAC value. MAC is maximum at 6 months of age, ठीक है। 6 months of age में ऐसे याद रखना, बेबी सबसे ज्यादा हाइपर एक्टिव रहता है, तो मुझे उतना ही ज्यादा मिनिमम एल्वेओलर कंसंट्रेशन चाहिए टू नॉक ऑफ दैट बेबी, okay. And the old age, it decreases the MAC value, okay, it decreases the MAC value, okay. So that is the MAC which is there. Dr. Raina, you have asked me why there will be difference between the acute and chronic alcohol intoxication. What I understood was, in chronic alcohol intoxication, the brain will be like, first only usko depress करने के लिए we need more amount of the drugs, okay, because it has already been under the constant alcohol stimulation, and we need more amount of drug to cause the to knock off that patient. Okay, so that's why you just remember like increase in a chronic alcohol and it is decreased in the acute alcohol intoxication. Okay, now that is the oil gas partition coefficient, and otherwise the theory behind it I'll just read and let you know why exactly in chronic alcohol intoxication I need to increase, and in acute alcohol intoxication I need to decrease. The basic theory I'll read it and let you know. Okay, so this was about the minimum alveolar concentration and the oil gas partition coefficient. Is it clear? These two concepts are very important. ऑयल गैस पार्टीशन कोएफिशिएंट हमें पोटेंसी ऑफ द ड्रग के बारे में बता रहा था, more potent. Okay, and minimum alveolar concentration की definition is very important, and it is very important to remember the minimum alveolar concentration of common inhalational agents. Okay, it is very important to remember these. Okay, so now coming to the another important concept, which is the blood gas partition coefficient. Okay, is everyone with me? Any other doubts? Dr. Raina, that answer I'll just tell you tomorrow. I'll just read the theory and let you know. Okay, should I move forward? Please tell me if I can move forward. Okay. Now, what is blood gas partition coefficient? Blood gas, as the name suggests, it is the concentration of the anesthetic agent in the gas upon which is not dissolved in the blood. Okay, so it is like जैसे ये एल्वुलर है, ठीक है, इसके अंदर एनेस्थेटिक एजेंट आ रहा है, तो हाउ मच अमाउंट ऑफ इट इज डिसॉल्व्ड इन द ब्लड एंड द वन विच इज प्रेजेंट इन द गैसियस फेज, उन दोनों का रेशियो इज द ब्लड गैस पार्टीशन कोएफिशिएंट. इज इट क्लियर? ठीक है, ये डायग्राम क्लियर हुआ? ओके, व्हाट इज ब्लड गैस पार्टीशन कोएफिशिएंट? दिस इज द alveolar. Okay, this is the alveolar. This is my inhalational anesthetic. Some amount of inhalational anesthetic will be soluble in the blood. It will get soluble in the blood. ठीक है, and that will depend upon its solubility in the blood. जितना ज़्यादा वो blood में solubility होगी, उतना ज़्यादा it will be dissolved with the blood, and उतना ही कम मेरा gaseous form में present होगा. ठीक है, so it is nothing but the concentration of this which is soluble in the blood, okay, and the concentration which of the inhalational agent which is present in the gaseous form. इन दोनों का ratio is the blood gas partition coefficient, and it is nothing but it measures the solubility of the anesthetic agent in the blood. Okay, so अब अगर एजेंट विथ लो ब्लड सॉल्युबिलिटी है, ये जो एनेस्थेटिक एजेंट है इट इज नॉट वेरी मच सॉल्युबल इन द ब्लड, तो क्या होगा? इसका मतलब हाई कंसेंट्रेशन इन द एल्वेओलर एयर. इधर ये सॉल्युबल नहीं हो रहा है, इट इज नॉट दैट सॉल्युबल इन द ब्लड. दैट मीन्स हायर कंसेंट्रेशन ऑफ इट विल बी प्रेजेंट इन द एल्वेओलर एयर, and as it will diffuse less through the alveolar capillary membrane. And this alveolar concentration determines the induction and recovery. More the amount of the inhalational agent in the gaseous form in the alveoli which is not dissolved in the blood, more faster is the induction and more faster is the recovery. Is it clear? Is it clear? ठीक है, मैंने क्या बोला? More the inhalational anesthetic, okay, present in the gaseous form, okay, that is, it is less soluble in blood, okay. Faster will be the induction, faster will be the induction, and faster will be the delivery, and faster will be the recovery. Okay, so that means the blood gas coefficient जितना ज़्यादा होगा, blood gas coefficient जितना ज़्यादा होगा, उसका क्या होगा? More it is soluble in the blood, then less it is inversely proportional to induction and recovery. Okay, so blood gas partition coefficient is inversely proportional to the induction and recovery. ऑयल गैस पार्टीशन कोएफिशिएंट हमें क्या बता रहा था? वो पोटेंसी ऑफ द ड्रग बता रहा था, हाउ मच पोटेंट इट इज. But blood gas partition coefficient tells us about the speed of induction. More the blood gas, so blood gas partition coefficient is inversely proportional to the speed of induction. Is it clear? Is it clear? I'm going very slow because these concepts are very important. If you don't understand this, it will be difficult for me to discuss tomorrow's topic. Okay, that's why I'm going slow and repeating it. ठीक है, ऑयल गैस से क्या पता चल रहा था? मिनिमम एल्वेओलर कंसंट्रेशन और ऑयल गैस में क्या रिलेशनशिप था, और ब्लड गैस पार्टीशन कोएफिशिएंट क्या होता है. दिस इज वेरी इंपॉर्टेंट. इज इट क्लियर? Any doubts? Okay. तो जो xenon है, इसका blood gas partition coefficient is the least among all the inhalational agents, but it is not that commonly available. ठीक है, so it has the least blood gas partition coefficient. मतलब अगर मैं xenon दूंगी तो सबसे ज्यादा जल्दी patient induce होगा, and this is the ideal gas. But amongst the inhalational agents which are available to us, like halothane, iso, CO, desflurane, उसमें से जो desflurane होता है, उसका blood gas partition coefficient is 0.042, which is least among the inhalational agents which are available to us, and therefore it has the fastest onset and recovery amongst the available inhalational agents. और methoxyflurane का blood gas partition coefficient is 15, which is the highest, and therefore it is the slowest to induce. Okay, methoxyflurane में बहुत ज़्यादा टाइम लगेगा rather than the xenon and the desflurane. Okay, is it clear? Is it clear? Blood gas partition coefficient क्या होता है? जितना ज़्यादा anesthetic agent ब्लड में सॉल्युबल होगा, उतना कम वो गैशियस फॉर्म में प्रेजेंट होगा, और ये जो गैशियस फॉर्म इन द एल्वेओलाई में होता है, इट टेल्स अस अबाउट द स्पीड ऑफ इंडक्शन एंड रिकवरी. Okay, lesser the amount of anesthetic agent in the gaseous form, lesser will be the speed of induction and recovery. Is it clear? Okay, is it clear? Okay. So now I told you about three main concepts. Going to the fourth concept, and mind me, अभी जो मैं बताऊंगी, the concentration effect, I'll tell you about three important points, that are the concentration effect. ठीक है, दूसरा बताऊंगी what is second gas effect. ठीक है, और तीसरा बताऊंगी diffusion hypoxia. This I will tell you in relation to the nitrous oxide. Okay, this all concepts, these three concepts I'll tell you in relation to the nitrous oxide. Okay, now what is concentration effect? It is seen with the nitrous oxide. देखो, इसको भी समझने की अच्छे से कोशिश करना. This is the alveoli and this is the blood vessel. Okay, now the inhalational anesthetic agent is coming along with यहाँ पे nitrous oxide plus oxygen plus volatile anesthetic is coming. Okay, and from the alveoli it will keep on diffusing. It will keep on diffusing into the blood vessel till the time equilibrium is reached. till the time the amount of gas which is present in the alveoli is equilibrium to the amount of gas produced in the blood vessel, it will go on diffuse from the alveoli till the blood vessel, है ना. तो ये जैसे alveoli है, ये गैस है, ये keep on diffusing into the blood vessel unless the equilibrium is reached. Is it clear? Is it clear? तो अगर मेरे पास जो इनहेलेशनल एनेस्थेटिक है, ठीक है, जो हम लोग इनहेल कर रहे हैं, उसमें नाइट्रस ऑक्साइड है प्लस ऑक्सीजन है, एग्जाम्पल आई एम गिविंग, ठीक है, प्लस हैलोथेन है. नाइट्रस ऑक्साइड 80% है, ऑक्सीजन 18% है और हैलोथेन 2% है. वो आया कॉमन गैस आउटलेट से और वो आ गया एल्वुलाई के अंदर, ठीक है, एल्वुलाई के अंदर. अब एक इम्पॉर्टेंट पॉइंट याद रखना कि जो ये नाइट्रस ऑक्साइड है, इट डिफ्यूजेस वेरी फास्ट. The nitrous oxide, it diffuses very fast as compared to the other gases. Okay, it diffuses very fast as compared to the other gases. तो क्या हुआ, नाइट्रस ऑक्साइड, ऑक्सीजन, हैलोथेन आया एल्वुलाई के अंदर. अब नाइट्रस ऑक्साइड बहुत जल्दी से डिफ्यूज हो जाता है. वो जब तक डिफ्यूज होगा जब तक इधर द एल्वुलाई का नाइट्रस ऑक्साइड concentration is not in equilibrium with that of the blood vessel. तो इनिशियली क्या होता है, इनिशियली व्हेन आई एम इंड्यूसिंग द पेशेंट, एल्वुलाई में तो बहुत ज्यादा नाइट्रस ऑक्साइड है मगर ब्लड में 0 है. तो नाइट्रस ऑक्साइड जल्दी 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 एल्वुलाई से ब्लड में चला जाएगा टिल द इक्विलिब्रियम इज मेंटेन. ओके, सो इनिशियली अगर देखा जाए तो इस मिक्सचर में नाइट्रस ऑक्साइड कितना परसेंटेज है, 80 अपॉन इन इसका टोटल 80 प्लस 100 प्लस 2 दैट इज 80%. 80%. नाउ व्हाट हैपेंस, इक्विलिब्रियम अटेन हो गया, ठीक है. नाइट्रस ऑक्साइड सबसे पहले डिफ्यूज हो गया, ऑक्सीजन और हैलोथेन अभी नहीं हुआ है बिकॉज नाइट्रस ऑक्साइड इज द फास्टेस्ट टू डिसॉल्व, ठीक है. अब इधर 40% हो गया, इधर 40% हो गया. ओके, एंड बिकॉज अब एल्वुलाई में तो 100 ऐसे याद रखो, एल्वुलाई में तो 100 मॉलिक्यूल्स ऑफ गैस हो सकते थे और अभी कितने सिर्फ 60 मॉलिक्यूल्स. तो इसके अंदर कैपेसिटी 20 और मॉलिक्यूल्स लेने की, इसके अंदर कैपेसिटी 20 और मॉलिक्यूल्स लेने की, ठीक है. तो अब इसमें ये जो 40% नाइट्रस है, इसका रेशियो कितना हो गया, इसका रेशियो 40% अपॉन 40 प्लस 18 प्लस 2, इसका रेशियो कितना हो गया, इसका रेशियो बढ़ गया, इसका रेशियो 66.6% हो गया. इसका परसेंट क्या हो गया, 66.6. मतलब उसने अपने आप को कंसंट्रेट कर लिया and that is the concentration effect. The percentage of the nitrous has increased in the alveoli and this is the concentration effect. Is it clear? Is it clear? समझ में आया, ठीक है. What is concentration effect? जो nitrous oxide होता है, it is the gas which diffuses very fast as compared to the other gas. Okay, and it will go on diffusing from the alveoli till the blood vessel to the blood vessel till what? Till the equilibrium is reached. Okay, so when the equilibrium is reached, उसका अगर हम percentage निकालेंगे तो that percentage is more, okay, amongst all other gases and this is known as the concentration effect. That is known as the concentration effect. ठीक है. नाउ अब ये एल्वुलाई है, इसके अंदर पहले इनिशियली देयर वर 100 मॉलिक्यूल्स, ठीक है, 100 मॉलिक्यूल्स ऑफ मिला के नाइट्रस, ऑक्सीजन और हैलोथेन मिला के. अब 40 इधर चला गया तो बचे कितने, इसमें बचे अब 60. तो इसके अंदर हम 40 और ऐड कर सकते हैं, 40 और ऐड कर सकते हैं. सो बिकॉज द एल्वुलाई इज लिटिल एम्प्टी, more amount of the anesthetic agent, more amount of the gas will be sucked from the gas supply. It will be sucked from the gas supply. So more amount of the gas will be sucked from the gas supply. ठीक है, कंसंट्रेशन इफेक्ट याद आ गया, समझ में आया. नाउ व्हाट इज सेकंड गैस इफेक्ट. ये जो हैलोथेन है, ये जो हैलोथेन है, इट इज लेस डिफ्यूजिबल. ये जो हैलोथेन है इट इज लेस डिफ्यूजिबल. तो हम क्या करते हैं, हम इसको हर समय हाईली डिफ्यूजिबल गैस लाइक नाइट्रस ऑक्साइड के साथ देते हैं. ठीक है, तो नाइट्रस ऑक्साइड जल्दी जल्दी डिफ्यूज हो गया, एल्वियोलाई खाली हुआ, ज्यादा गैस और सक होगी सेकेंड टाइम पे, सेकेंड उस पे, तो हैलोथेन का भी तो कंसेंट्रेशन इंक्रीज हो जाएगा. एंड दिस इज नोन एज द सेकेंड गैस इफेक्ट. This is known as the second gas effect, which is seen with the nitrous oxide. As halothane is less diffusible, तो इसको हम लोग highly diffusible gas nitrous oxide के साथ देते हैं. ठीक है, तो so along with the nitrous oxide, क्योंकि nitrous oxide जल्दी से diffuse हो गई, alveoli खाली हुआ और गैस अंदर आ सकती है, उस गैस के अंदर और halothane आ रही है. ठीक है, so along with the nitrous oxide, halothane will also be delivered to the lungs from the gas supply, and this is known as the second gas effect. Is it clear? Is it clear? This is very important. बहुत important है ये. Dr. Raina, is it clear? Please give me a thumbs up and please let me know if there is any doubt. Okay, anyone else, if there are any doubts, let me know. Okay, now diffusion hypoxia क्या होता है? What is diffusion hypoxia? तो concentration effect पता चल गया, second gas effect पता चल गया. Now what is diffusion hypoxia? Diffusion hypoxia क्या होता है? जब रिकवरी हो रही है, ठीक है, रिकवरी हो रही है, इनहेलेशनल एजेंट्स, मतलब प्रोसीजर खत्म हो गया एंड वी वांट द इनहेलेशनल एजेंट्स टू कम आउट टू बी एक्सपैंड. जब रिकवरी होती है तो रिवर्स होता है. नाइट्रस ऑक्साइड जो है उसकी बहुत लो ब्लड सॉल्युबिलिटी है. ठीक है, इट हैज अ वेरी लो ब्लड सॉल्युबिलिटी. तो क्या होता है, ये ब्लड के अंदर नाइट्रस ऑक्साइड की सॉल्युबिलिटी बहुत कम है. ठीक है, इट इज नॉट मच soluble, it is present more in the gaseous phase. So during recovery ये जल्दी से वापस से alveoli में आ गया, ये जल्दी से वापस से alveoli में आ गया. तो यहाँ पे जो ऑक्सीजन पहले से प्रेजेंट है वो इस नाइट्रस से डाइल्यूट हो गई, क्योंकि ऑक्सीजन वापस इतनी जल्दी नहीं आ पाया, ऑक्सीजन इतनी जल्दी नहीं आ पाया क्योंकि उसकी सॉल्युबिलिटी इतनी मतलब उसका जो सॉल्युबिलिटी है वो ब्लड में ज्यादा है नाइट्रस ऑक्साइड से. नाइट्रस ऑक्साइड जल्दी से यहाँ पे एल्वेoli में वापस आ गया और उसने क्या किया, ऑक्सीजन को डाइल्यूट कर दिया. उसने ऑक्सीजन को डाइल्यूट कर दिया, ऑक्सीजन का जो परसेंटेज है एल्वेoli में वो कम कर दिया. उसकी वजह से क्या हो सकता है, उसकी वजह से हाइपोक्सिया हो सकता है, एंड दैट इज व्हाट इज नोन एज डिफ्यूजन हाइपोक्सिया. इज इट क्लियर? ठीक है, तो डिफ्यूजन हाइपोक्सिया क्या है? ड्यूरिंग रिकवरी रिवर्स अकर्स, ड्यूरिंग रिकवरी रिवर्स अकर्स. नाइट्रस ऑक्साइड है, इट हैज लो सॉल्युबिलिटी, नाइट्रस ऑक्साइड हैज लो सॉल्युबिलिटी एंड देयरफॉर इट रैपिडली डिफ्यूजेस. अब क्या था, रिकवरी के वक्त ब्लड वेसल में इनहेलेशन एनेस्थेटिक ज्यादा था, एल्वेoli में कम था. ओके, नाउ जल्दी से नाइट्रस ऑक्साइड एल्वेoli में वापस चला गया, उसने क्या किया, ऑक्सीजन को डाइल्यूट कर दिया. इट डाइल्यूट्स द alveolar air and therefore partial pressure of oxygen in the alveoli is reduced and therefore there is hypoxia and that is known as diffusion hypoxia. Is it clear? अब इसको हम लोग प्रिवेंट कैसे कर सकते हैं? इसको हम लोग प्रिवेंट ऐसे कर सकते हैं, पहली बात नाइट्रस ऑक्साइड को हम लोग पहले बंद करेंगे. We will not give nitrous oxide at least 5 to 10 minutes prior to the completion of the procedure. ठीक है, और उस समय में I'll denitrogen मतलब I'll just give 100% oxygen. That means I'm increasing the concentration of the oxygen in the alveoli so that it does not get diluted with the nitrous oxide. Okay, so it can be prevented by continuing 100% oxygen inhalation a few minutes after discontinuing the nitrous oxide. And therefore अब alveoli में क्या हो रहा है, ऑक्सीजन जो है वो बहुत ज़्यादा बढ़ता गया है, ठीक है. Oxygen is increased, the oxygen it is 100%, it is increased, and nitrous oxide जो है it is comparatively, this nitrous oxide it is comparatively less, and therefore oxygen का dilution partial pressure ज़्यादा कम नहीं होता है, and therefore there is no hypoxia. Is it clear? So that is diffusion hypoxia. Any doubts regarding the oil gas partition coefficient, the MAC, blood gas partition coefficient, concentration effect, second gas effect, or the diffusion hypoxia? These 6 concepts which I have told you is very important. On NEET exams and AIMS में direct questions इसमें से आते हैं, ठीक है. I'm just revising it once more. Oil gas partition coefficient, I'm just revising it once more. The oil gas partition coefficient is telling me about the potency of drug, ठीक है. MAC, the minimum alveolar concentration, is inversely proportional to the potency of drug, ठीक है. Oil gas partition coefficient, potency of drug, and the lipophilicity of drug, ठीक है. And blood gas partition coefficient, it is telling me about the induction, speed of induction and the recovery. So blood gas partition coefficient is inversely proportional to the speed of induction and recovery, okay, from the inhalational anesthetic. ये समझ में आ गया, okay. और जो 3 concepts मैंने बताए, the second gas effect, the concentration and diffusion hypoxia, it is related to the nitrous oxide, ठीक है. क्यों होता है? Because nitrous oxide is easily diffusible, उसकी solubility in the blood is very less, okay, and therefore we are seeing the concentration effect, the second gas effect, and the diffusion hypoxia. Is it clear? Now coming to the first inhalational anesthetic, which was used in the past, okay, that is ether. Today I'll just discuss in detail about ether. Tomorrow I'll discuss about the halothane, iso, CO, DES and nitrous oxide, ठीक है. तो ether में क्या है? First of all, we have to W.T.G. Morton, he was a scientist, he was a dentist and a medical student at Boston. कभी कभी हिस्ट्री भी पूछ लेते हैं, इसलिए ईथर का the first demonstration of ether was done by a dentist named Dr. Morton, and this was in 1846, ठीक है. And ये जो ईथर है, इसको हम लोग कंप्लीट एनेस्थेटिक एजेंट मानते हैं. कंप्लीट एनेस्थेटिक एजेंट का मतलब क्या हो गया? एमनेसिया, एनाल्जेसिया एंड मसल रिलैक्सेशन, बिकॉज इट हैज ऑल दीज 3 प्रॉपर्टीज, नार्कोसिस, एनाल्जेसिया एंड मसल रिलैक्सेशन. तो इसमें तीनों चीजें हैं. नाउ व्हाई इज इट ऑब्सोलीट? Why is it no more used? That is because it is highly inflammable and explosive, and therefore it is obsolete now. And it is the most emetogenic, सबसे ज़्यादा vomiting produce करता है amongst the inhalational agent. Okay, so ये दोनों इसके side effects हैं, ठीक है. Other thing which is important in ether is इससे the BP, the patient is hemodynamically stable, the BP and the respiration is well maintained, and it does not sensitize the heart to adrenaline. All the other inhalational agents, they sensitize the heart to catecholamines, to adrenaline, except ether. Okay? And it can cause, but it can cause hyperglycemia, and therefore it is not indicated in case of diabetic patient. Ether, WTG Morton याद रखना है, ठीक है. Second, complete anesthetic agent, but highly explosive. Okay, but it is highly explosive. Okay, so this is ether. Now, first ether demonstration, WTG Morton, ओपन ड्रॉप मेथड. ओपन ड्रॉप मेथड का मतलब क्या हुआ? जिससे क्लोरोफॉर्म को सुंगा देते हैं, ठीक है, और पेशेंट बेहोश हो जाता है. वैसे ही पहले ये जो मास्क है, दिस मास्क इज नथिंग बट द शिमल बुश मास्क. दिस इज द शिमल बुश मास्क. इसके अंदर ऐसे गॉस पीस रखते थे और इसके अंदर ईथर लगाते थे और वो बस पेशेंट को सुंगा देते थे. ठीक है, तो इसमें हो सकता था कि ईथर का कंसंट्रेशन ज्यादा हो या फिर कम जा रहा हो. ठीक है, देयर वाज नो मेजरमेंट, स्पेसिफिक मेजरमेंट. तो दिस शिमल बुश मास्क, याद रखना, ओपन ड्रॉप मेथड, ओपन एनेस्थीसिया सर्किट का एग्जाम्पल है, और इसके ऊपर ऐसे गॉस पीस रख देते एंड द ईथर एनेस्थीसिया वाज गिवन. ओके, नाउ another important question which is asked is, what are the stages, what are the 4 stages of anesthesia? Can anyone tell me Goodell ने anesthesia में और क्या contribute किया था? There is something which is named after him. There is something in anesthesia which is named after him. He also gave Goodell's oropharyngeal airway. ठीक है, so याद रखना. So Goodell, he described 4 stages of anesthesia, but these are true only with ether. These are true only with ether. So first stage क्या है? That is the stage of analgesia. When I am giving the anesthetic inhalational till the loss of consciousness is the first stage. Beginning of anesthetic inhalational till the loss of consciousness is the first stage. What is stage 2? The stage 2 is loss of consciousness till the beginning of the regular respiration. That is the state of delirium or the excitement. Okay. There is, ये याद रखना, roving of the eyeball, pupils slightly dilated, and eyelash reflex is lost. It is the first reflex to be lost. Okay, that is the eyelash reflex. Okay, so stage 1, stage of analgesia. Stage 2 is the stage of excitement. Stage 3, very important, it is the stage of surgical anesthesia. Okay, it is the stage of surgical anesthesia, and it is the beginning of the regular respiration till the cessation of the spontaneous respiration, and this stage is further divided into the 4 planes. Okay, and stage 4 is nothing but the medullary paralysis. So stage 1 analgesia, stage 2 delirium and excitement, stage 3 is the stage of surgical anesthesia. Okay, and this in turn is divided into 4 planes, and stage 4 is medullary paralysis. तो पूछा जाता है सर्जरी कब परफॉर्म करनी चाहिए? द अप्रोप्रिएट स्टेज इज स्टेज 3, प्लेन 3. Stage 3 का भी plane 3 is the one which is appropriate for the surgery. Okay, and the first reflex to go is the eyelash reflex, which I already told you. Okay, so is it clear? The Goodell's 4 stages of anesthesia: open drop method, Schimmelbusch mask, ether. Okay, so this is clear. So आज की क्लास में I just discussed about the basics which are related to the inhalational anesthetics. Tomorrow I'll discuss about what are the different effects of these inhalational agents on the different organ systems. ठीक है, कहाँ पे उसको contraindicated है, कहाँ पे indicated है, all those things. Okay, so that was all for today's class. Okay, that was all for today's class. We have a Telegram, on the Telegram app, we have a channel that is livedaily.me on NEET PG channel. Through this channel, you will come to know about the daily live classes which are on YouTube and on the special classes. These will be updated on this channel. Okay, and also if any doubt, you can drop the doubt in this channel and that will be taken care by the educators. And by getting the Unacademy learning app, install it and get a Unacademy Plus subscription. The Unacademy Plus subscription, I told you what are the advantages: the live classes, I'll be able to talk with the top educators, and also daily test series and analysis will be happening, and also live doubt clearing sessions. So it gives you an environment like a classroom, live classroom environment. Okay, it's an interactive thing. And also the subscription either 12 months or a 24 months course, and if you apply my code, that is Apurva Live, you can get 10% discount on the same. And on the YouTube we have a channel Unacademy NEET PG. Subscribe to it, click the bell icon, like and share, and get and use the code, referral code Apurva Live, and get 10% discount on the Unacademy subscription. Okay, Dr. Raina, the PDF of this class is not available, but the PDF forms are available in the special classes. Okay, the other platform, that is the special classes, in that we have the PDF of this class. Okay, so you can attend those classes and get the PDF form. Okay. Okay, that was all for today's class. If any doubt, please let me know. If there are any doubts, please let me know. Okay, thank you.